Hello. In this video, I'll talk about the sexual side effects of antidepressants and practical solutions to manage them. How do antidepressants affect sexual function? Antidepressants, particularly selective serotonin reuptake inhibitors, are highly effective in treating depression and anxiety. However, they can lead to sexual dysfunction in the following ways: reduced sexual desire, loss of libido, delayed or inhibited orgasm in both men and women, erectile dysfunction, difficulty achieving or maintaining an erection, vaginal dryness in women. These side effects occur because antidepressants alter brain chemicals like serotonin, which regulate mood but also play a role in sexual response. Why are these side effects overlooked? People often feel hesitant to discuss such issues with their doctors. Treatment tends to focus on mental health symptoms, sidelining side effects. There can be confusion over whether the problem stems from the medication or the underlying mental health condition. Solutions and strategies. Have an open conversation with your doctor. Talk to your doctor without hesitation. They can adjust your dosage, switch your medication, or offer alternative solutions. Consider alternative medications. Some antidepressants carry a lower risk of sexual side effects, such as bupropion, Wellbutrin, known for minimal impact on sexual function. Mirtazapine, Remeron, may improve libido in certain cases. Adjust timing. Taking your medication after sexual activity or changing the time of day you take it can help. Add-on medications. Your doctor might prescribe medications like phosphodiesterase inhibitors to address specific sexual dysfunctions. Psychological approaches. Cognitive behavioral therapy can help reduce performance anxiety and improve sexual satisfaction. Lifestyle changes. Regular exercise, a balanced diet, and stress management can enhance overall sexual health. Pelvic floor exercises, Kegel. Strengthening pelvic floor muscles can improve control and boost sexual function. When to seek professional help. If side effects persist despite medication adjustments. If sexual dysfunction significantly impacts your quality of life or relationships. A sexual health specialist or psychiatrist can offer tailored treatment options. Thank you for watching. If you found this video helpful, don't forget to like and subscribe to my channel. Remember, always consult your doctor before making any changes to your medication.